Gentlemen, let me ask you something personal. Have you recently experienced something confusing during intimate moments? You feel everything building up, you reach that peak of pleasure, but then nothing comes out? If you're nodding right now, I need you to listen carefully. What you're experiencing has a name, it's more common than you think, and most importantly, it's not the end of your intimate life. I'm Dr. Mia Carter, and for over a decade, I've specialized in men's sexual health here at True Wellness Network. Today, we're tackling a topic that thousands of men are secretly Googling at 2 a.m., too embarrassed to ask their doctor about. But here's the truth. This condition is your body's way of communicating, not failing. Let's start with a basic fact that might surprise you. Orgasm and ejaculation are two completely different events. Your brain controls the pleasure. That's the orgasm. Your body controls the release. That's ejaculation. Throughout most of your life, they happen together so perfectly that you never notice their separate systems. But when one changes and the other doesn't, that's when confusion and panic set in. What you're experiencing is called anejaculation or dry climax. You're reaching full orgasm, feeling that intense sensation, but there's minimal or zero fluid release. And I know what you're thinking. Does this mean I'm done? Is my body giving up on me? Absolutely not. Let me explain what's actually happening. The real reasons behind dry climax. Reason number 1, the backward flow. Imagine a door at the base of your bladder. During normal climax, this door slams shut, forcing everything to exit forward. But sometimes, due to surgery, medication, or nerve changes, that door stays open. The fluid takes the easier path, backward into your bladder instead of forward and out. This is called retrograde flow. And here's the interesting part. You'll often notice your first urination after intimacy looks cloudy or foamy. That's the fluid mixing with urine. It's harmless, just redirected. Common triggers? Prostate surgery, certain blood pressure medications, and alpha blockers for enlarged prostate. The surgery saves your life, but it can alter the mechanics. Reason number 2, the production problem. Your body produces this fluid in specialized glands, the seminal vesicles and prostate. Think of them as factories. If these factories slow down production, there's simply less output. What causes the slowdown? Testosterone decline. After 40, men lose about 1% of testosterone yearly. By 60, many men are running on half capacity. Less testosterone means less fuel for these glands. But here's the good news. This is testable and treatable. A simple blood panel can reveal if hormones are the culprit, and modern hormone optimization therapy can restore not just fluid production, but energy, desire, and overall vitality. Reason number 3, the blockage. Sometimes the production is fine, the door works correctly, but the delivery system is clogged. Past infections, inflammation, or even small calcifications can block the ducts that carry the fluid. Men describe this as feeling a dull ache or pressure during climax, or they notice the volume decreasing gradually over months or years. This often responds well to anti-inflammatory treatment or minor procedures to clear the pathway. When this becomes urgent. Now, while most cases are manageable, I need you to understand the warning signs that demand immediate medical attention. See a doctor. This week, if you experience sudden onset with no history of surgery or medication changes, pain during climax or blood in your urine, complete loss of sensation in the genital region, difficulty urinating, or fever alongside this symptom. These can indicate neurological issues, uncontrolled diabetes complications, or in rare cases, more serious urological conditions that need prompt diagnosis. The emotional reality. Let's address the elephant in the room. For many men, the absence of visible fluid feels like losing proof of masculinity. You might be avoiding intimacy, feeling inadequate, or wondering if your partner notices or cares. Here's what I tell every patient sitting across from me. Your worth as a man, your ability to connect intimately, and your capacity for pleasure are not measured in milliliters. The psychological impact is real. Anxiety, performance fear, relationship strain, but it's rooted in a misunderstanding. Once you grasp that this is a mechanical or chemical issue with clear solutions, not a verdict on your manhood, everything shifts. I've watched men in their 60s and 70s reclaim satisfying, intimate lives after understanding and addressing the root cause. Your best years are not behind you. Your action plan. 3 critical steps. Step 1. Get evaluated. Book a consultation with a urologist. A detailed history, simple exam, and targeted blood or urine tests will pinpoint the exact cause in most cases. Stop guessing, start knowing. Step 2. Optimize your foundation. Control diabetes, manage blood pressure, maintain healthy cholesterol. These conditions directly affect blood flow and nerve function in your reproductive system. What's good for your heart is good for your sexual health. Step 3. Open communication. Talk to your partner. Most relationship strain comes from silence and assumption, not the condition itself. Share what you've learned. You'll be surprised how understanding and supportive they can be. And if medication adjustment, hormone therapy, or a minor procedure is recommended, trust the process. Modern urology has excellent solutions for nearly every cause of this condition. Gentlemen, aging doesn't mean accepting decline. It means understanding your body's changing language and responding intelligently. Dry climax is not a stop sign, it's a signal. And signals can be decoded, addressed, and often reversed. Your intimate life, your confidence, and your connection with your partner can remain vibrant and fulfilling for decades to come. But only if you take that first step, seeking answers instead of hiding in shame. If this video gave you clarity or hope, do 2 things for me. First, hit that subscribe button and join the True Wellness Network community. We're building a space where men can talk openly about real health issues. Second, share this with someone who needs to hear it. Your father, brother, or friend might be silently struggling with the exact same concern. Drop a comment below telling me where you're watching from, or if you have questions, ask them. I read every single one, and your engagement helps this message reach more men who desperately need it. Remember, your health is your wealth, and knowledge is the first step to taking control. I'm Dr. Mia Carter from True Wellness Network, and I'll see you in the next video. Stay informed, stay confident, and stay well.